The human foot has 26 bones, 33 joints, 107 ligaments, and 19 muscles. Any pain or injury to your feet or lower legs will greatly impact your quality of life. The Family Foot and Leg Center is a state-of-the-art facility with experts in the field of foot and lower leg pain.
At the Family Foot and Leg Center, we keep you walking. Our basic mission here is to offer complete foot and ankle care and lower leg care. We definitely thrive to be on the cutting edge of technology in our profession. Sometimes people have an arthritic joint in the big toe joint. So what we do is we take a metal part, we resurface this joint, which is actually a new concept. We used to replace the whole joint by cutting out a significant amount of bone. With the new technology, we just go ahead and resurface it, minimally invasive, and people are back on their feet the same day with this toe implant for the big toe. So if you have severe pain that you think may be a bunion, sometimes people think it's a bunion, but it's really not. It's just an arthritic toe joint, and we can replace it very easily, and people are on their feet very fast with this new resurfacing technology that we have to offer here. When people have degenerative arthritis of the ankle, such as from a trauma, you suffer an ankle fracture in the past, or it's just from overuse, from degeneration. So same thing, we replace it with a metal part, but this has a little plastic bearing here that glides. And this is the newest advancement in the ankle replacement surgery, because now we have a metal part that stimulates the talus bone portion, versus before they're trying to make the joint a ball and socket joint, which the ankle is not. So this follows the actual contour and motion of the natural ankle, which by design is supposed to last longer than the previous ankle implant, which unfortunately has had a bad name up until now. Ultrasound is used for diagnostic purposes to look for inflammation of tissue, look for torn tendons and ligaments. This helps to save patients time and money. Instead of going to an MRI, we can diagnose a significant amount of soft tissue diseases with the ultrasound technology that we have available here.
I came down to Naples for one reason, really, is to treat complex deformities in foot and ankle. You know, my training program really consisted of a multitude of things, particularly revision surgery and complicated, non-unions and things like that, fractures and things like that. So I wanted to bring that kind of advanced treatment down to this area, and I know Dr. Kevin Lamb has done a good job bringing that here as well. So I wanted to kind of extend that legacy that he's already started here. This is the practice that sets an example for other practices in this area to follow. It's a standard, it's raising the standard of this area. So as far as what I bring to this practice, I hope is another component to that excellence. I think patients would want to come see us here because we care about our patients. We try to explore all the newest technologies, the latest cutting-edge treatment modalities for foot and ankle care. Any people with ankle arthritis or chronic pain in their ankles, we have a multitude of treatments that we perform here that have done patients very well to avoid fusions. And that's really what we're trying to do, is avoid the fusion. That may not happen for everybody, but it certainly will happen for a majority of patients with severe ankle arthritis here.
Before, I couldn't even sleep. At night, the pain was unbelievable. It's a miracle. He did a fantastic job. He's a wonderful surgeon, a great caregiver, and very attentive in following up. I had no arthritis pain in that toe. And I was just like, I can't believe this. It's like a gift.
There was an insect bite that started to grow down by my ankle, and it got worse over a period of time. It started to turn into a wart, and I came here and the staff was so friendly, and I had it cut off, and they put my foot in a little bandage. They put a bandage around my ankle, and then a few weeks later I came back to have the stitches removed, and they explained everything really nicely. And I had a great experience here, and I would recommend this place to anyone.
I had gotten 2 other opinions besides his, and the 2 other doctors, they didn't want to do what he showed me I really needed to be done, and pretty much the 2 other physicians said that I would need to have surgery probably again in 2 years. the same exact surgery. Well, it's been about 1.5 years since the surgery, and I'm pretty much pain-free. I have had my follow-up appointments with Dr. Lamb where he's taken x-rays, and the results have been phenomenal. Dr. Lamb's staff are most professional, as well as Karen, who is his manager. Everybody has been very easy to work with. They fit my appointments in according to my work schedule. As far as pricing is concerned, he takes my insurance, which has been Blue Cross Blue Shield, and I totally recommend him to anyone. He's the best here in Naples.
I had a flat foot. I didn't have my arch on either foot, and Dr. Lamb said I need to get that done by an operation. The experience after the surgery, it actually feels better because I can walk perfectly fine. And before I would walk inward, not outward, and now I can walk perfectly well.
You can trust the Family Foot and Leg Center. Call or visit online today.